So the cost of dental implants, lots of questions about the cost. So what affects the cost?
Yeah, so I have a list of things that affect the cost. There are about 9 things
Okay.
that affect the cost of dental implants. The first thing is, what kind of implants are these people using? And there's many types of implants. There's like, porcelain implants that we don't use. There's mini implants that we don't use at all.
Okay.
They're just not good.
Okay.
And so, and we use the gold standard implant, and it comes with many shapes and sizes, and that affects the cost of it.
Okay.
And so the next thing that affects the cost is how many doctors are involved in the process.
Okay.
Generally, it's 2. In other offices, there's two doctors involved. In my office is 1.
Okay.
So we can pass along the savings to the patient by doing.
So there's one doctor that does the surgery?
Yes.
Or one office, and then another office that puts the teeth on top?
Exactly.
You do both parts?
We do both parts.
Okay.
And the third thing is how much surgery is needed. And so, some people require bone grafting, some people require sinus lifts. We just can't know until patients come into my office what they need.
Okay.
And so the next thing that affects the cost is the lab bill. And so in my office, we heavily invested in technology, and we can make the teeth in-house. We can print them in-house.
So it's like a digital printer?
It's a digital printer, exactly.
And then you just print them right out?
Print them right out.
Leave with those teeth?
Leave with those teeth, same day or next day.
Okay.
Going down the list, insurance coverages.
Yeah, what does insurance cover?
So generally, insurance doesn't cover implants. They don't cover that. They generally cover cleanings, your fillings, your crowns, and things like that.
Like the max payout in Alabama is what?
It's like about $1,000 to $2,000
a year.
A year.
Okay.
And so we can definitely use that for you in my office, but the majority of my patients finance this procedure.
What about Medicare and Medicaid?
Yeah, they don't cover implants as well.
So financing, not just in your office. I mean, across the country, they're financing these procedures.
Yeah, everyone's financing it.
All right. You have to have OK credit.
You have to have OK credit, but we can discuss that in my office. We have an excellent finance team that can go over all the options. And
people are even getting co-signers. Sorry to interrupt, but they're even getting co-signers.
Yeah, people are getting co-signers for this. They're getting family members to help. I mean, people want to get this done, and they're excited to get this done. And I want to get this done for them. So we have our finance team. We have everyone that wants to help them get this procedure done for them. So the next thing that makes up the cost is what are the teeth actually made out of? So some offices use like denture teeth to make the final teeth out of them, like the acrylic denture teeth, plastic teeth. But in our office, what we do is we do zirconia. It looks like porcelain. It's porcelain teeth. It's hand contoured, hand glazed.
They look like real teeth?
They look like real teeth. A lot of patients don't know. You probably couldn't even tell between someone's natural teeth and these teeth, because they're handmade.
Okay, nice. What else?
So the next thing, we warranty our dental implants and teeth. And so in my office, and we maintain them. So you're not going to other places. And so in my office, you come see me I want you to come see me for a very, very long time. And so another thing that affects the cost is, are you getting a snap-in denture, or are you getting teeth that don't come in and out? Okay. And that affects the cost. The material differences.
One is less.
Yeah, one is less, and one's teeth that are actually porcelain made out of zirconia, and one's actually acrylic and denture teeth. Okay. And so and finally, in my office I do everything. From the surgery portion to the teeth portion, and so
experience? How big of a role?
We have experience.
Because you teach this to other doctors.
I teach this to other doctors.
You've done hundreds of these procedures.
Hundreds of these procedures. I've placed almost 1,000 implants.
Okay.
In my office, and so experience matters, and you want to get this done with someone that does. This is all I do. So we want to get this done with someone that this is all they do as well.
So when somebody calls your office and says, "How much are dental implants?" It's just not that easy.
It's not that simple.
So the catch is they got to come and see you.
They got to come and see me. It's a free consultation.
Okay.
And we'll go over everything with them. We'll go through, what the best treatment options are for them, and we'll go through their financing options. And I want the patient to make sure that they are fully comfortable and they understand what.
Now you
what
said you did, and I'm paraphrasing you, but you did market research. You're less than just about everybody else.
Yeah.
To get the same procedure done.
The same procedure done. So most people aren't doing this procedure like we do it. Okay. And so
which is one doctor, one fee kind of a thing.
Exactly.
Making the teeth right there.
Exactly.
In the office.
And so we're doing it 24% cheaper than anyone else in my area.
That you know of.
In my area, yes, that I know of.